name is Morgan. I'm a home health nurse. How are you doing today?
Pretty good. How about yourself?
I'm doing pretty good, thank you. We're going to get your heart rate, your respiration rate, and your blood pressure today, your vital signs, and then we'll do a brief assessment on you. Is that okay?
Yeah, that's good.
Okay, good. I'm going to close the door and give you some privacy. I'm going to clean my hands with this hand sanitizer. Are you having any pain today?
Well, I do have some pain in my knee, and well, right now it's not really hurting, but it is a little bit swollen.
Okay. Okay, so after I get your vital signs, we can assess your knee pain a little bit further, okay?
All right.
So I'm going to start and get your temperature here.
Okay.
Okay, so your temperature is at 98.4. It's perfectly normal.
Okay, good.
Can we get your blood pressure? Bit of a squeeze for a moment. Your blood pressure is about 140 over 90. Are you taking any blood pressure medicines currently?
I do take blood pressure medicine, but I haven't taken mine today because I normally take it at nighttime before I go to bed. So I haven't taken it yet.
Okay, so you want to make sure you take that regularly to keep your blood pressure under control.
Okay.
I'm going to get your heart rate on your wrist here. Okay, so your heart rate is 64 beats per minute. Normal is between 60 and 100, so that's good.
Okay, good.
I'm going to get your respiration rate. I'm going to put my stethoscope on your chest here, and you can just breathe normally.
Okay.
Okay, so your respirations are at 16. Normal is between about 12 and 24, so that's good also.
Okay, great.
And you said you were having some knee pain, is that correct?
Yeah, I guess in the past few weeks it was sore, and then whenever I would walk, it would be, kind of painful then. My doctor prescribed some meloxicam, and that has helped a lot. But right now it's not in pain, but it does still seem to be a little bit swollen.
Okay, okay. Well, we're going to assess that a little bit further here, so I'm going to have you lay back.
Okay.
And are you having any pain elsewhere?
Well, I was having some shoulder pain too, and it's mostly whenever there is air conditioning, and sometimes if I sleep at night on this particular shoulder. And I guess probably several years ago I had a car accident, and my shoulder was dislocated, and so they did say it would be a possibility that it could be arthritis that might develop in it later.
Okay.
So,
Okay, and then you mentioned you were taking some meloxicam for your knee. Have you taken any other pain medications?
I have taken some ibuprofen. I I just take it, whenever it's needed, not necessarily, every day do I need it.
Okay, so I'm going to assess your abdomen, your GI system. Oftentimes with pain medicines, it can affect your GI system. Have you had any difficulty as far as having any nausea or any abdominal pain?
No, I haven't.
Okay, what about diarrhea?
No.
Okay, very good. So I'm going to listen to your abdomen and make sure your bowel sounds are present. Okay, so your bowel sounds are present in all 4 quadrants. I'm just going to press on your abdomen a little bit here. Any tenderness when I'm pushing?
No.
Okay, good. Have you noticed any distension or any constipation?
No.
Okay, very good. So or a few side effects of the meloxicam as well as other forms of ibuprofen are diarrhea, stomachache, nausea. So if you experience any of those symptoms, definitely let your doctor know.
Okay.
And I'm just going to assess your arms a little bit. You said it's this shoulder that's been bothering you? Okay, let me come over to this side. I'm going to take a look at that shoulder here. I'm going to raise up your sleeve and have you to relax your arm here. Does it hurt just lying there like that?
No, it doesn't.
Okay, so I'm looking at your shoulder and I'm feeling it here. It doesn't feel warm and I don't feel any swelling, any puffiness, so that's very good. Just going to move your arm up and down here. Does that hurt at all when I do that?
No.
Okay, and then I'm going to pull your arm out just a little bit. Back to your side, out again. Let me know if you feel any pain while I'm doing that.
Well, actually, that does feel kind of uncomfortable.
Okay, a little bit uncomfortable. Okay, so we'll let that relax there. But otherwise, your skin is feeling normally warm, not abnormally.
Okay.
Have you noticed any chills or any fever with your pain?
No, I haven't.
Okay, good, good. And so, any trouble with that other shoulder?
No,
Just going to
this
come
one
around
actually-
to that side.
This one actually feels pretty good.
Okay, so we're just going to do the same thing on this side and
Okay.
check out your shoulder up here just to compare it to the other one. Okay, and have you relax your arm a little bit. So no redness or warmth on this shoulder either. They both look about the same size, so that's good. Your skin is normally warm, so I don't feel that you're abnormally hot or anything. I'm just going to bend your shoulder here or your elbow. Any pain when I do that?
No.
Okay. Just going to do the same thing and lift your arm out and back to the side. Any pain as I'm doing that?
No.
Okay, very good. So your range of motion is very good, although you said that other shoulder does give you a little bit of discomfort, but overall your range of motion is very good.
Okay.
So we're going to check out your legs here. And which knee has been bothering you?
It's my right knee.
Okay. So no swelling or anything on this knee you've experienced? Okay. I'm going to feel on this knee here. It looks like both of your legs are looking normal. Both of your leg parts are intact and the same or together, so that's very good. I do note a little bit of puffiness in this knee compared to this one. Any pain when I feel on it?
No.
Okay. So I'm just going to assess here. Okay, so just a little bit of puffiness, but not significantly. The fluid does not shift as I push on your kneecaps here, so that's very good. And there's no redness or warmth there either compared to this one, so that's very good. Now we're just going to test your range of motion here just like we did with your arms. And I'm just going to move your leg up and down and let me know if you feel any pain when I'm doing that.
Okay.
Okay, up and then down. Any pain as I'm doing that?
No.
Okay. Alright, and we'll do it with this one as well. Any pain? I know you said that knee was the one that was giving you trouble.
No, actually, it feels pretty good today.
Okay, so it's at about a 0 today. And how would you describe your knee pain usually?
I guess if you would say on a scale of 1 to 10, maybe a 5 or 6.
Okay, and does it seem to hurt worse at a particular time of day?
No, it could be any time, but especially, when I move around, especially if I've been sitting for a long time and get up and move around, it does tend to, really bother me.
Okay, so it gives you some, or it's a little bit stiffer when you have been sitting down for a long time. Okay, does it hurt with activity? Does it interfere with your daily activities such as walking or just, casual walking or getting up and down?
I guess casually walking, it does sometime. And then when I'm at home, we have a lot of stairs, so it kind of bothers me to go up and down the stairs.
Okay, and is there any particular movement that worsens it?
Well, basically
Just
bending
climbing
it
the stairs?
and
Okay.
climbing the stairs.
Okay, okay. And then is there any activity that improves it?
I guess if I try and do a little exercise with it, like you did with, stretching it up and down, that seems to help a lot.
Okay, good. So that's good. It improves with exercise. So that's very good. Let's see. So you noted that there's no particular time of day that it hurts and gives you some stiffness when you've been sitting for a while. Climbing up the stairs kind of bothers it a little bit, but not significantly, would you say?
Right.
Okay,
Right.
so just a little aggravation.
Right.
Have you noticed any swelling or fever with your knee pain, in association with your knee pain?
No, I haven't.
Okay, all right. So we're going to keep an eye out on that. Like I said, it looks like the fluid around your knee is not significant, but there is some present, definitely. So we're going to check out some labs today and do some labs and to kind of rule out some of the possible causes of that knee pain, okay?
Okay.
So we're going to call the doctor in so he can assess you today. And is there anything else that I can help you with, or did you have any questions?
No, I don't. I know that I had heard that exercise help it, and so I guess that's pretty true.
Oh, yes.
Exercise, tend to help.
Okay. Yeah, definitely exercise, moderate exercise. You definitely wouldn't want to overdo it. Things such as water aerobics is always nice. Being in the water with the cool water can oftentimes help the pain and relax your muscles. Have you used any warm compresses?
I haven't.
Okay, so warm compresses can sometimes help. Have you used any other therapies to help the pain?
No, other than, well, I did put some alcohol on it, but it didn't really seem to, do anything that way.
Okay, so the alcohol didn't really help much, but the warm compresses could possibly help. And the meloxicam, how is that doing for you?
Actually, it feels a lot better when I put the meloxicam on it.
Okay, good. So it sounds like you're doing all the right things, taking the meloxicam as needed, not overdoing it, because as I mentioned, it can cause some gastric issues, and if you experience any of those, you definitely want to let the doctor know. And to try that exercise and that warm compresses, I think will definitely help you.
Okay.
Okay. Well, I'll call the doctor in. Okay.
Okay.
You take care.
All right.